Dr. Ishan. So we move on to our last presenter, Dr. Vaishnavi Patil. She'll be speaking on magnitude of different lid tumor presenting in a tertiary hospital of North Karnataka. Dr. Vaishnavi.
Good evening all. I am presenting my work on magnitude of different lid tumors presenting in tertiary hospital of North Karnataka. The eyelid is a common area where skin cancer occurs, constituting 5 to 10% of all skin cancers. Most eyelid tumors are benign and constitute 82 to 98% of all eyelid tumors. The majority of the eyelid tumors arise from the epidermis, categorized into epithelial and melanocytic types, with basal cell carcinoma and melanocystic lesions accounting for 85% of the cases. Squamous cell carcinoma and melanoma are rare on the eyelid, with adnexal stromal tumors less frequent. Other tumors include lymphoid tumors, hematomas, and choriostomas. Inflammatory and infectious conditions commonly mimic neoplasms. This is a retrospective study aiming to explore the diverse presentations of lid tumors and to establish correlation between the clinical findings and histopathological features for diagnosis. The study location is Shri B.M. Patil Medical College and Research Center, Vijayapura, North Karnataka. Duration is 3 months from January to March 2023 and sample size is 438. Detailed clinical history was taken and an examination was done. Management strategies including surgical and medical interventions were documented and reviewed. Biopsy reported were analyzed to elucidate the histological characteristics of eyelid tumors and correlated with clinical findings. The results showed mean age of the patients 52.48 plus minus 26.20 years, with 54% being male and 46% being female. The results were as follows. 152 cases had lid warts, 101 cases had chalazion, 79 had lipoma, 56 had cystic lesions, and 22 had sebaceous gland carcinoma, 18 melanocystic tumors, 9 sweat gland tumors, and 1 squamous cell carcinoma. Histopathology and clinical correlation correlated in 182 patients and did not correlate with 43 cases. These are some of the images. First is squamous papilloma, then lipoma, then cyst of mole, followed by pyogenic granuloma adherent to the lid margin, the sebaceous gland carcinoma, and sty. Sebaceous gland carcinoma is seen here, lobulated appearance with increased vascularity and mitotic figures. Second image shows squamous cell carcinoma with keratin pearls. Conclusion: lid tumors have a varied age of presentation with more female preponderance. Lid warts are most common, followed by chalazion in this demography. Sebaceous gland tumors are more common malignancy of lid in the North Karnataka. And histopathological correlation of the excised tumors is of utmost importance for confirming the diagnosis and planning further management. These are my references. Thank you.
Again, like, what were you trying to get at with the presentation like this, you know?
Ma'am, most of the medical colleges emphasize on teaching cataract surgery to the students. So with this, we were trying to find out how many patients come for lid swellings and how many of them get treated properly or referred properly. So we just wanted to, with this study, we just wanted to have an overall idea of how many lid tumor patients come and get treated in our hospital.
You know what, like, you should focus more on maybe diagnosis here rather than statistics, because all these are well-known facts. So I mean, my advice, or whatever you call it, to you would be, don't spend time on looking at these. I mean, spend time on looking at how you can diagnose them better. I mean,
Yes,
what are you really getting at by knowing the number of cases coming? You have to look at that thing. What are you spending your efforts for?
Yes, ma'am.
Which though ultimately you have to learn from it.
Yes, ma'am, lesions like warts and chalazion. Chalazion we treated, some were treated with antibiotics, some were treated with intralesional triamcinolone. So those patients were not sent for histopathology or
No,
other
the things which you said are already well known. Like these are the cancers you get, this is what you get, this is what you get. I mean, what I'm trying to say, why do these things? I don't see any take home messages from here. She wanted to say something?
No, no, it's my thing. What I want to say is for all of you. It's okay. I think she can go or you can.
You say.
I just want to tell generally to all of you. See, it is a digital world. It's everywhere around how to prepare a PowerPoint. I found not a single person with 6x6 slide rules. PowerPoint preparation, the way you project, the way you say, and every PowerPoint presentation should end with a take-home message. We hardly found any.
Yes.
Just go through this. It's everywhere around in all your colleges. It should be a practice when you present in your seminars. So that is what is being done in TOT. 4 minutes में present करना है. And how you present, how are your PowerPoints is very important. Okay, thank you.
Thank you.